Hi Brian, my name is Kelly. I'm going to be your nurse today. I'm going to be doing a head to toe assessment on you. Would that be okay with you?
Sure.
Okay. First thing I'm going to do is I'm just assessing the general skin condition of you. The skin looks nice and warm and dry and it looks pink. I don't see any kind of skin breakdown. The next thing I'm going to do is I'm going to assess your head and your face. So I'm going to step behind you. I'm going to touch you.
Okay.
I'm just looking at your scalp. I don't see any kind of skin breakdown. Your hair is clean. I don't see any hair missing. And I'm just going to touch your cranium. Good. It's nice and round. Good. The next thing I'm going to do is I'm going to have you puff out your cheeks and close your eyes real tight. Wrinkle your forehead and clench your jaw. Keep your jaw clenched. I'm just going to try to test for muscle strength. Okay. Looks good. The next thing is I'm going to be assessing your temporal arteries. Good, nice and regular. Assessing the TMJ. Open wide and side to side. Good. And I'll be assessing your sinuses, your maxillary sinuses. Any tenderness?
No.
Okay. And your frontal. Any tenderness?
No.
Okay, good. The next part of the assessment I'll be assessing is your ears. And I'm just taking a look. Skin looks good, no skin breakdown. Looking at your tragus, pushing them down. Any tenderness?
No.
The auditory meatus looks nice and clear in both. We'll just be doing a whisper test, so I'm going to whisper into your ear. Just tell me what you hear.
Okay. The book is on the table.
And then this ear as well.
The dog is outside.
Okay. The next thing I'll be doing is assessing your vision. And normally we would be doing what is called a Snellen test. I'm going to explain it. We won't actually be doing it right now. It'll be a chart that will be on the wall. I'll have you cover one eye, and you'll read a line and continue to read smaller lines until you're not able to read anymore. You would keep your glasses or your contacts in. Do you have contacts in right now?
Yes.
Okay. So we would do that. And then the next part of the test, testing your visual, the visual fields, would be the kinetic confrontation. So I'm going to have you cover your right eye. I'll cover my left eye. And I'm going to have you tell me how many fingers you see.
1, 2, 3, 1.
And the other eye?
1, 1, 1, 5.
Okay, good. The next part of the vision test is the 6 cardinal gazes. These are testing your extraocular muscles. So just keep your head straight and follow my finger. Good. Perfect. The next test is we're going to do a corneal reflex test. So I'm just going to grab a cotton ball right here, and I'm just going to go right near your eye. Good. And you blink. So that's perfect.
Yep.
The next thing is I'm just going to take a look at the physical part of your eye. Looking at the conjunctiva, it looks nice and white and clean and pink. The sclera is nice and white, and the iris and the cornea look good as well. And I'm just going to shine a light in your eye. This is assessing your pupil reflex, part of the Perla assessment. Good. Good. And then I'm just going to have you look straight ahead. And then just follow my finger. Good. And your pupil is constricted, so I would document that as Perla present. The next part of the assessment is your nose. Just observing it, it looks nice and symmetrical. I don't see any lesions, anything like that. I'm just going to test. I'm going to have you close your eyes right now, and I'm just going to have you, we're going to do a smell test. Can you tell me what you smell?
Garlic.
Perfect. Great. then you can open yours. The next part of the test is I'm going to just be assessing your mouth and your throat. Part of this assessment would be a testing for the gag reflex. We won't be doing that. I will explain it. It's something that you do with patients that are not conscious or maybe having swallowing issues. You would stick something and kind of touch it to the back of the throat, and that should elicit a gag reflex. Okay, so at this point, I'll just have you open your mouth, and I'm just going to take a peek in. Good. The buccal mucosa looks nice and pink. All teeth are present. The top of the mouth, the palate looks good. Can you lift your tongue out? Good. And lift it up? Good. Everything looks good there. I'm just going to take a peek at your gums. Nice and pink. Okay. I didn't notice any kind of bad breath, and your tongue is midline with a nice white coating on it. The next thing I'm going to do is I'm going to assess your neck. And just general observation, it looks good. I don't see any kind of issues, any kind of skin breakdown. I'm assessing your carotids. Good, I can feel them. Good. Looking at the trachea, just making sure it's midline. It is. The next thing I'll be doing is palpating lymph nodes. There's 10 of them we'll be doing. Let me know if you feel any kind of tenderness or anything. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Any kind of tenderness?
No.
Good. Next, we'll be doing some range of motion. So I'm just going to have you touch your chin to your chest. Good. And back up. And can you put your head all the way back? Good. And side to side. Good. And I'm going to be testing resistance, so I'm just going to have you push forward, push back, good, push to the side, and push to the side. Perfect. The next part of the test is I'm going to come back here, and I'm just going to feel for your thyroid gland. Any kind of tenderness?
No.
Okay, good. At this point, while back here, I'm going to be assessing the posterior lungs. I'm just going to ask you to take your shirt off for me. Good. Just observing the skin back here. It looks nice and warm. It's not diaphoretic. I don't see any kind of skin breakdown, no lesions. There are quite a bit of freckles and moles, though. It'd be something just to keep an eye on. I'm going to palpate it. I'm just going to touch. I'm touching for any kind of masses. Good. I'm feeling for the spinal processes, starting at T1, just feeling your spinal cord, just making sure everything is straight. Okay. Yep, everything feels good there. The next thing I'm going to do is I'm going to test. I'm just going to have you sit on this side right here, just so we can just show the camera what we're doing. I'm going to test for symmetrical chest expansion. I'm just going to place both hands right here. Have you take a deep breath in and out. Good, nice and even. I'm going to assess for CVA tenderness, which is for the kidneys. I'm putting my hand here. Any tenderness?
No.
Okay. I'm going to be auscultating at 5 sites on the posterior chest as well as laterals. Always starting right here. Deep breath in. Good. Good. And the laterals. Deep breath. Good. Lung sounds are nice and clear. And I'm just going to ask that you sit right here, and just so you can just face the camera. At this point, I'm going to be moving to the front, and we're going to be assessing the anterior chest. Just looking at respirations, they look nice and normal. You don't appear in any respiratory distress. I'm going to palpate, just feeling for any masses. Skin feels nice and warm and dry. Thorax is at the appropriate size and position. And we'll be auscultating for 5 sites on the anterior chest. Deep breath in. Good, nice and clear. The next part of the assessment is going to be testing your upper extremities. So I'm just going to be feeling with the dorsum of my hand, just if you could just put your hands out, thank you. Skin feels nice and warm. I don't notice any edema. I'm just going to take a look at your fingers, assessing for cap refill, less than 2 seconds. Good. Now I'm just going to feel for the joints. Any tenderness?
No.
Okay, good. Good. And we'll just do the same thing over here. The nails are nice and pink. They're nice and round. I don't notice any kind of clubbing. Good. And I'm going to feel for pulses. So I'm going to start with the radial pulse. I'm going to have you turn over. Nice and regular. A brachial pulse. Good, nice and regular. And then I'm just going to have you hold your arm like this, and we're feeling for the epitrochlear lymph. Any tenderness?
No.
Okay, good. And you can just relax. Next thing I'm going to have you do is just grasp my fingers, squeeze them tight. Good. And I'm going to have you take your hands and go up and down in midline, and just go up a little bit, looking for ulnar deviation. Spread your fingers out, make a fist. Finger, pinky and thumb together. Good, perfect. And I'm just going to have you do some resistance. So try to push up and try to push down. Good. All right. I'm just going to be stepping back here and just assessing your shoulder strength against resistance. Can you try to push up? Good. We'll be doing range of motion in your shoulders. So I'm going to have you put your hands up above your head, behind your back over your head, praying. Good. And then just in front of you like this. Perfect. That looks good. I am just going to take a moment and look at my sheet just to make sure I didn't miss anything. All right, one thing I did not have you do is I just want you to open your mouth and say ah. Good, I can see your tonsils, everything looks good there. And then I'm just going to be assessing your arm strength. So I'm just going to grab your arms and try to lift your arms up and down. Good. At this point, I'm going to ask you to lay on the couch, and we're just going to be moving on with the assessment. All right. Are you comfortable?
Yes.
Okay. Are you in any kind of distress, any pain anywhere?
No.
Okay, good. All right. So the first thing I'm going to have you do is I'm going to turn your neck towards me. I'm just assessing the jugular vein. Good. I can see it. Looks good. It's not protruding. If it was protruding, that would be a sign of congestive heart failure, and we would do the appropriate intervention from there. All right. The next part of the assessment is the heart assessment. I'm just inspecting the precordium. I don't notice any kind of heaves or lifts. The next thing is I'm going to palpate. I'm going to palpate for the apical impulse at the 5th intercostal space at the mid-clavicular line. Good. And I'm just going to take a listen. We're going to start with the aortic site. It's at the 2nd intercostal space on the right side. So how we look for that is we start at the clavicle, 1, 2. Good, nice and regular. And we're at the pulmonic site at the 2nd left intercostal space. Moving down to the 3rd left intercostal space at Erb's point. The 4th intercostal space on the left side, the tricuspid. And the 5th, the mitral, at the 5th intercostal space at the mid-clavicular line. And I'll be doing the same thing with the bell of my stethoscope. This is listening for any kind of abnormalities. The aortic, the 2nd right intercostal space. The pulmonic, the 2nd left intercostal space. Erb's point, the 3rd intercostal space on the left side. The tricuspid, the 4th intercostal space. And the mitral, the 5th intercostal space. I'm just going to listen for the rate and the rhythm for about 15 seconds at the 5th intercostal space here, the mid-clavicular line. Good, nice regular pulse. I can hear the S1 and S2. The next part of the assessment is the abdominal assessment. And I'm going to be just observing first. The first part of the abdominal assessment is inspection. I don't notice any distension. Skin color looks good. No skin breakdown. Hair is in a uniform fashion. The next part is auscultation. We start in the right lower quadrant and move up. We're in the right lower quadrant, the right upper quadrant, the left upper quadrant, and the left lower quadrant. And I hear bowel sounds in all 4 quadrants. The next thing we're going to do is we're going to percusp in all 4 quadrants with 3 sites in each of the quadrants, so for a total of 12. So let me know if there's any pain, any tenderness. Then we're zigzagging up to the right upper quadrant. Good. Left upper quadrant. And the left lower quadrant. Good. I don't hear any kind of dullness. The last part of the abdominal assessment is the palpation. We'll just be doing light palpation. Any tenderness? We're starting in the right lower quadrant. Right upper quadrant. Left upper quadrant. And the left lower quadrant. Does that feel okay? Okay. Let me know anytime if you're any kind of pain, any tenderness, or any discomfort, okay? The next part of the assessment is the lower extremity assessment. And I'm just doing a general observation. I'm just going to feel with the dorsum of my hands. Good. Temperature, nice and warm, nice and dry. Skin color looks good. It looks nice and pink. I don't see any kind of skin breakdown. I'm going to assess for pulses. I'm going to assess for the popliteal pulse. It's going to be right behind the knee. And I can feel that. It's nice and regular. The dorsalis pedis, which is kind of the inside of the ankle. Nice and regular. Oh, excuse me, that was the posterior tib. The dorsalis pedis is on top of the foot. Good. Perfect. And we're just going to do some range of motion with your ankles. I also don't notice any kind of edema whatsoever. I'm going to have you put your ankle up like this. Good. And down, point it, out, and in. Good. And then we'll just be doing some muscle resistance. Can you push up? Good. And then can you try to push out with your ankle, though? No. Thank you. Perfect. And you can relax. I'm just taking a look at your toes individually. Good. Everything looks good. All nails are present. No skin breakdown. Assessing for cap refill. Good. And I'll be assessing for the Babinski reflex as well. So I'm just going to take this and just go real hard. Good. Negative Babinski reflex. While you're here, I'm just going to have you take your ankle and go from your, and rub it against from here all the way down here. Good. Can you do that on the other side as well? Perfect. At this point, I'm going to have you get up, and I think we're going to continue on with the neuro part of the assessment. All right. I'm just going to take a look at my sheet just to make sure I haven't missed anything up until this point. This is the second time I'm looking at my sheet. All right, the first thing I'm going to do is I'm going to test muscle strength of your knees. Can you try to push up? Good. And can you try to push up? Good. And then I'm going to have you close your eyes, and I'm going to place an object into your hand, and can you just tell me what the object is?
Cotton swab.
Perfect. Then, and I'll do one more.
Flashlight.
Perfect. You can open your eyes. The next part of the neuro assessment is that I'm going to have you, I'm going to have you take your hand and go real fast like this. Perfect. Yep. Great. The next part of the assessment is I'm going to have you, get up, and then I'm going to have you walk across the room back and forth, okay?
Mm-hmm.
And I'm just going to move your shoes out of the way. Okay. All right, so can you walk straight across for me? Good. And then when you come back, can you go heel, toe, heel, toe? So heel, toe, heel, toe. Good. Walk on your heels and walk on your toes. Good. Okay. And then we're going to stand right in the middle just so we can get the camera can see us. And we're gonna do some spine movements. So I'm gonna have you turn like this and bend down. Perfect. The next thing I'm gonna do is we're gonna walk over to the couch and we're gonna be doing shallow knee move. So I'm gonna have you place your hand like this, and I'm gonna have you go like this. Perfect. And opposite. Good. And then I'm just going to ask you to stand in the middle of the room. The next thing I'm going to do is the Ron work test. We're going to be doing this for 20 seconds. And I'm going to just have you close your eyes. And I'm going to kind of push you a little bit. This is just maintaining, seeing if you can maintain balance. Perfect. You can open your eyes. I'll just have you take a seat. Perfect. One last thing I did forget to do is I'm just going to have you lean forward a little bit for me. And I'm just listening at the fifth intercostal space, just listening for any kind of abnormalities. And then I'm going to ask you to lay down on the couch. And I'm going to have you lean slightly to your left.
To the left or right?
To the left. Yeah. And I'm just going to take a listen, just listening for any kind of cardiac abnormalities. No murmurs. Everything sounds great. Good. Okay. Brian, thank you so much for the exam. It's been a pleasure.
Sure. Thank you.